and provision of support to any woman who is about to have an abortion, while health facilities across the country, including the Victoria Jubilee Hospital, provide support to women who present with complications from unsafe abortions, effectively and contradictorily being an accessory to a crime after the fact. And whereas all parliamentarians in this Honourable House have a moral obligation to ensure women can enjoy their personhood without interference. And whereas the government has an obligation to give women who need to procure an abortion with access to safe and affordable services for the termination of pregnancy. Be it resolved that this Honourable House considers the recommendation of the Abortion Policy Group, which was established to provide guidance to allow women the right to choose. Be it further resolved that this Honourable House takes steps to repeal Section 72 and 73 of the Offences Against the Persons Act and substitute it with a civil law titled Termination of Pregnancy Act, as a recommendation by the Abortion Policy Review Group in 2007.
Questions and answers to questions.
Mr. Speaker, there are some questions in my name posed to the Prime Minister to be answered today. Can you indicate whether they're going to be answered?
Mr. Seeking.
The PM isn't here, and I've got no information on it, so I cannot respond.
Mr. Speaker, notwithstanding his absence, can an inquiry be made to find out if the questions are going to be answered today?
Mr. Speaker, I beg to give notice that at the expiration of 21 days, I will ask the Minister of Transport and Mining the following 3 questions tabled in my name.
Speaker, as we are on answers to questions, you will recall at the last sitting when the Minister of Energy, Science and Technology made a statement, some questions emanated from that statement, and the undertaking was given that this next sitting this week, the answers will be provided. It would be very helpful, Mr. Speaker, if you could advise us what is the progress with those questions that the Minister promised to provide.
Well, as you see, the Minister is not here. As yet, he has not advised me. I wonder whether the Leader of Government Business can assist.
Mr. Speaker, the Minister is not here, and I don't recall that an undertaking was given that will be done this week. What he said will provide answers to the question, but I don't recall it says this week. But he's not here at this time, so I'm unable to elaborate on it.
For clarification, Mr. Speaker, you'll recall I had insisted to get some time frame, and you gave the undertaking that you will seek to have it for this week. It's against that background that I saw the update from you.
Mr. Jackson, as I said, he's not here. I was not informed. I cannot question him at this time, but I certainly will do so when he arrives. Motions that may be made at the commencement of public business requiring notice. Motions relating to the sitting of the House. Motions for leave to introduce bills. Presentation of bills without leave of the House first obtained. Public business.
Mr. Speaker, on the public business, we have a resolution, an order, the Honourable Minister of Local Government and Community Development to take the local government municipality Portmore change of name order resolution 2018. Sectoral debate will continue with the Minister of Health, the Member of Parliament for South St. Catherine, the Member of Parliament for North Central St. Catherine. So at this time I invite you to ask you to invite the Minister to deal with this resolution. The Minister of Local Government to deal with this resolution first.
Minister Mackenzie.
Thank you, Mr. Speaker. Mr. Speaker, I rise to start the debate on the motion standing in my name under government business on the order paper, entitled the Local Governance Act, Municipality of Portmore Change of Name, Order Resolution 2018. Mr. Speaker, the House is aware that with the passage of the 3 strategic laws which address local government in general and in particular the Local Governance Act 2016, the names of all the local authorities were officially changed from parish councils to municipal corporations. The exception to this designation was Portmore, which already, Mr. Speaker, existed as a municipality under the now repealed Municipalities Act and was therefore continued as a city municipality under Section 5, subsection 3A of the Local Governance Act, Section 5, and also contain the official name of the municipality of Portmore. The official name, Mr. Speaker, has presented the local authorities with practical challenges that makes its representation to local and overseas partners and other people within the area very difficult, Mr. Speaker. The name provides no distinction in the public mind between the physical space that contains the municipality and the executive local authority. This has created difficulty for both the administration and the employees and the elected representatives as they try to communicate with stakeholders, to do business and to provide service and market the local authorities as an organ of development and change based on the 3 bits of legislation that was passed by this Honourable House under the previous administration. Following consultations, Mr. Speaker, between senior representatives of the municipality, the ministry, the Portmore municipality, at its meeting on June 14, 2017, decided to pursue Section 5 of the Local Governance Act to seek a name change from the municipality of Portmore to the Portmore City Municipality. This was followed by a formal request which was received by the ministry and approved by me as minister. The ministerial order has been subsequently created, Mr. Speaker, dated February 9th, 2018, is the Local Governance Municipality of Portmore Change of Name Order 2018. It draws its legal authority from Section 535 of the Local Governance Act and declares that the municipality of Portmore is to be now known as the Portmore City Municipality. Mr. Speaker, I seek the indulgence and the support of this Honourable House to bring this resolution and approve same, Mr. Speaker.
Mr. Jackson.
Mr. Speaker, I offer no objection whatsoever to the name change. It's a further evolution of the Portmore community and the municipality. And as the minister said, the Portmore remain the same, and the space. So is the Member of Parliament for Portmore too, my fellow MP from Southeast St. Catherine. But Mr. Speaker, it's really an evolution. And as we go through this exercise, I want to put in the records, the memories of some of the stalwarts from Portmore who fought and struggled to create the municipality back in 2003. Persons like the late Mayor George Lee, Big George, and some stalwarts in Portmore who fought not for the mere symbolism of the name, but to create an authority that can be responsive to the needs of the residents of Portmore. You see, Mr. Speaker, we found ourselves in an awkward situation in Portmore, where we were administered from Spanish Town. And for many other communities throughout St. Catherine, they saw Portmore as being not in need of much because of the level of physical development. But if you know the residents of Portmore well, they don't settle for mediocrity. And they're always pressing for the place to be better, and therefore wanted a local authority that could assume that responsibility and see to the development. Mr. Speaker, Portmore is tremendously better for the creation of the municipality back in 2003. And I look forward to its further development. I assure you the leadership that it has and the leadership that it will continue to have will ensure that Portmore becomes the envy of other local authorities throughout Jamaica. Mr. Speaker, I support the motion before us.
Mr. Fagan.
Mr. Speaker, my only disappointment in the statement of the minister is that he said that there were a number of consultations. I can't recall being invited to any such consultation. Mr. Speaker, Mr. Speaker, my colleague, Member of Parliament, spoke to those persons in civil society who would have contributed significantly to the development and the evolution moving towards the municipality. I want for him not to leave out our own involvement. Persons like Dr. Paul Robertson, former Member of Parliament, himself, who has served and contributed significantly, and of course, somebody like Colin Fagan, who would have served coming from the community level to the point where it has reached this point. Now, Mr. Speaker, one of the things that wherever it is part of this whole business of reform and the reform process, we're always making adjustments and talking about what is next. And our government is speaking about another municipality, another town. Not too long from now, I suppose that will be put forward in this house. Are we now saying that Portmore is a city? I want to understand the distinction between, let's say, a Kingston, or a Spanish town, or a Montego Bay, where you say one is a city as against a town. How do you make the distinction? And is it to say that city municipality is designated to Portmore as a city, or Portmore remains a town? There's also, Mr. Speaker, at one time, when your administration, the administration now was thinking of looking at Portmore as a parish. In fact, Mr. Speaker, while I don't agree
that is before us, the Local Governance Act, Municipal of Portmore, Change of Name Order, Resolution 2018. As was said earlier, Portmore, the municipality of Portmore owes its very existence to exactly what we are looking for from local government, where the individuals, the residents who live there are clear in what it was that they wanted. Well do I remember that when we came in 2003 to actually establish that municipality, that it was really and truly a creature of the citizens and the residents and their desire for a governance structure that included their voice. And therefore, with the resolution passed in June 2017 for this name change, I do not believe that those of us who sit here would have any difficulty in supporting the wishes of the individuals who have started that process and who have been involved in the governance of the municipality over these many years. I know that there are some things that are outstanding as far as Portmore is concerned, and that we have the honor and privilege of supporting. Thank you.
Mr. Gould.
Mr. Speaker, I just wanted to make a very brief contribution on this matter. Just to clarify that under the Local Governance Act, and this is for the benefit of members, as I know the Minister is familiar, there are 3 categories of entity that are contemplated. One is the municipal corporation, what was formerly the parish council. Then there is a city municipality, and then there's a town municipality, which is the smallest of the 3. In Section 5, the transitional provision deemed the municipality of Portmore to be a city municipality for the purposes of this Act, but continued the name Municipality of Portmore unless the Minister by order determined otherwise. And that order has to be approved both by this House and the Senate. So the name that you're confirming today, Minister, is in fact consistent with the legal nature of what it is under the Act now, because it already is a city municipality and you're simply attaching the designation Portmore in front of it. And I think that is a logical outcome. I just wanted to clarify that.
Mr. Speaker, just want to thank my neighbor and my colleague on the other side, and just to say, Mr. Speaker, the contributions by the governors on that side with a slight, be gracious. Okay, Mr. Speaker. But, Mr. Speaker, just to say that this is not a controversial matter. This is a matter that speaks to the continuation of local government reform, which is an ongoing process. And so while we get closer to those reforms, but just a word of caution to my friend, the opposition spokesman on national security, when the other bill comes, I will get similar support from you on that other bill, Mr. Speaker. so, Mr. Speaker, with that, I ask that the bill seek the approval of...
That is correct, that's a draftsman. That is correct.
The question is that the motion number 8 on the order of business be approved. Those in favor? Those against? As have it. Motion approved.
Mr. Speaker, I now ask you to invite the Minister of Health to his contribution to the 2018 sectoral debate.
Dr. Tufton.
Mr. Speaker, let me begin this presentation by thanking the Honourable Prime Minister for his confidence in me in appointing me to this position, two plus years on. To my cabinet colleagues, Mr. Speaker, for their support, my colleagues on both sides of the House for their input in my stewardship. Mr. Speaker, I want to just recognize also the Ministry of Health, the Permanent Secretary and the Chief Medical Officer who provide leadership, the leaders of the respective units, the regional health. Mr. Speaker, as I did last year, given the limitations of time, I have tabled two documents, Vitals, which provides critical statistics on the performance of the health portfolio under the period of review, and highlights of key initiatives. And I commend to my colleagues, Mr. Speaker, for a more elaborate explanation of what has been taking place that they refer to that document. The two documents combined, Mr. Speaker, as well as my own contribution today, will provide a perspective on the performance of the ministry, the challenges, the opportunities, the achievements, as we seek to improve public health. Mr. Speaker, allow me, however, to highlight a few of what is elaborated more on in these documents that have been tabled. And I capture highlighting these achievements, Mr. Speaker, while saying that I think in public health and as a country, we have seen challenges, but there's reason to be thankful and there's reason to hope for even better days, Mr. Speaker. Mr. Speaker, we launched the Reduced Waiting Time initiative just over a year ago, and the intention there was to limit the time that patients waited in the accident and emergency wards of hospitals by shifting, through improved customer service and triage, persons who are non-emergency cases to the nearest health center. We took 8 health centers and the corresponding hospitals, and that process over the last year, Mr. Speaker, has seen some positive results. We have seen some 60,000 additional visits during the extended hours of those health centers, extended for up to 4 additional hours, and up to 66% of patients within those corresponding hospitals waiting an hour or less, Mr. Speaker, to see a doctor. We will, during the course of this year, Mr. Speaker, given the success of this reduced waiting time initiative, expand on that program. The Compassionate Care Program, which we launched, Mr. Speaker, on November 2018, March 2018, focused on improved customer service. You may recall that one of the concerns we had, Mr. Speaker, was to administer clinical care with compassion. And over the past months, we have trained over 60 frontline staff members, nurses included, at Victoria Jubilee and the KPH, and established that program, enhanced the aesthetics of the environment, improved facilities like bathroom facilities, and the feedback, Mr. Speaker, has been quite positive. During the course of this year, we intend to roll out to another 12 major clinics within the hospital system this compassionate care and volunteerism policy. Mr. Speaker, the National Cancer Treatment Center launched November 2017 at the Cornwall Regional Hospital, providing high-tech treatment using the high-tech linear accelerator, a modern piece of equipment which was supported by a number of stakeholders led by the National Health Fund, has seen some 1,409 procedures, treatment with radiotherapy, since it has been established, Mr. Speaker. And within another month or two, we will have the other piece of equipment at the St. Joseph's Hospital, which essentially will ensure that public health has the most modern piece of cancer treatment equipment. Mr. Speaker, we are making progress, and we can be hopeful that things will get better. Mr. Speaker, the cardiac unit at the Bustamante Hospital for Children, another legacy issue, but a lot of start-stops. I'm happy to announce, Mr. Speaker, that the operating theater has now been opened, and we have, in fact, Mr. Speaker, saved some 31 pediatric young lives since the opening of this. Within another month or two, the cath lab will be completed, Mr. Speaker. Again, a very valuable piece of infrastructure to support pediatric cardiac care. The China-aided Western Children's Hospital project, Mr. Speaker, a project that has been in the making for probably 5-6 years, starts and stops. Mr. Speaker, we took it, we advanced it, and I'm happy to announce that an implementation agreement has been signed, and we expect to break ground for the 220-bed facility, 16,000 square meters, providing pediatric and adolescent medicine and surgery, which in a manner, Mr. Speaker, that has never been seen in this country. And indeed, from the perspective of a specialist adolescent hospital, it will be the first, not just in Jamaica, but in the Caribbean. Mr. Speaker, we have reason to be hopeful. Mr. Speaker, our doctor clinic program, which we launched, where we took 100 primary healthcare facilities, profiled their needs, and launched to the community, both locally and in the diaspora, both NGO and business community, for adoptions to take place, essentially to help to look after these primary healthcare facilities, has seen significant success. We have seen over 50 expressions of interest. We have already launched at least 4, and Mr. Speaker, it is an excellent example of partnership between NGO and the private sector and the government in the interest of restoring credibility to primary healthcare facilities is what the intention is. Mr. Speaker, one thing we're particularly proud of in public health over the past year, and that is the expansion of nurses training, and in particular critical care nurses training, advanced training. You may recall, Mr. Speaker, that I reported to this House a year ago that our nurses are internationally demanded, in short supply, and we were restricted by the lack of capacity, clinical capacity in particular, to train here in Jamaica. In other words, we could train them in the theory, but we did not have enough hospital beds to train. We took this challenge of international recruitment and limited capacity to the international community. Indeed, I spoke to it a year ago at the WHO in Switzerland, Mr. Speaker, calling for countries to establish bilateral arrangement in advancing critical care training. I am happy to announce, Mr. Speaker, that a year on, we have signed not 1, but 2 bilateral agreements with our partners China, and the United Kingdom, where our Jamaican nurses will train for a part of their advanced training here in Jamaica and then go to Chinese and UK hospitals with their local tutors to complete their clinical rotation, Mr. Speaker. A significant achievement that has never occurred before. Mr. Speaker, the first batch of nurses will leave for China next month with their tutors, and we will begin the UK program in October with the first group leaving to Leeds Teaching Hospital next April. In the first year, Mr. Speaker, we will increase critical care nurses training by 100% as a result of this new program, Mr. Speaker. It is something to celebrate. And indeed, Mr. Speaker, the world is looking on this. In fact, we have been told by our partners that this may be a prototype which are training, because one country cannot do it alone, and there is a shortage of medical trained personnel globally, not just in Jamaica. I want to thank the Chinese government and the UK government, Mr. Speaker. It took a lot of negotiations. It took a lot of adjustment to the curriculum, the nurses and their association who have bought into this program, and I think Jamaica will be better off for it, and the profession will be better off for it, Mr. Speaker. Mr. Speaker, in terms of public-private partnerships, we again established, in the interest of reduced waiting time, private pharmacies to distribute public drugs. You may recall that we launched a pilot project with 17 pharmacies. Over the past year, over 70,000 prescriptions have been written through those drug serve windows located in private pharmacies. Mr. Speaker, we are rolling out an expanded program. We have identified another 35 pharmacies, making the total to be 52, along with the drug serve windows at the and a few clinics. We will have a network of outlets, Mr. Speaker, to distribute drugs. Thanks to the NHF and the team that have worked on this, no more will patients have to wait for medication. If they can't get it at the hospital, they could go to a private pharmacy to get those drugs, Mr. Speaker. Mr. Speaker, another significant achievement that will assist public health is the establishment last year of the Mosquito Control and Research Unit. Partnership, Mr. Speaker, between the University of the West Indies, our own internal vector control unit, supported by our bilateral partner, in this case the USAID, who gave us some 40 million Jamaican dollars to support. And what this entity, which is located at several locations, but the research component based at the University of the West Indies, will do is engage in research, various forms of research, on that deadly vector, the mosquito. Mr. Speaker, you will recall the CHIKV and the ZIKV experience, which literally brought the country to a halt as it relates to production and to productivity. Well, Mr. Speaker, this Mosquito Research and Control Unit is now actively engaged in research methodologies like sterilization, in actively breeding mosquitoes to study them, testing chemicals, looking at new and improved ways to confront this vector, and also mapping the country to identify the most vulnerable areas. Again, Mr. Speaker, this is a significant development that I believe will help not just Jamaica in confronting this vector, but indeed, working with CARFA, the regional research entity, we believe that the benefits here will extend to the rest of the region. Mr. Speaker, last year, we had some 1.246 million visits to our hospitals, 1.724, and I'm rounding the